Hello, everyone, and welcome to our latest community conversation at the Community Health Endowment. We're so excited to welcome you here today to listen to this important conversation on a very, very important topic. Before we get started, I'd like to give you just a little bit of news about an entirely different subject, and that is we've just received news that the Surgeon General of the United States, Dr. Murthy, will be visiting Lincoln here very, very shortly. And so I want you, if you are able, to keep an eye to the Community Health Endowment's social media, and so you can be aware when he'll be visiting and your opportunity to see him and visit with him about an important topic of youth, mental health, and social media use. We're very excited to be welcoming him to Lincoln, and we look forward to having him here. But on to today's topic. This is a really important thing. You know, I've been here at the endowment for about 25 years, a long time. And when you've been anywhere that long, you can reflect back and think about some really pivotal moments that you've had in your career, things that have really changed the trajectory of your own thinking. And I can tell you that one of those times was about 20 years ago when I first became aware of the work of peers, and peer support. Actually met my first peer. And it was really a very impactful moment for me, because I heard not only about the work of the peer, but this reciprocity, the way that the work was also supporting the recovery of the person. And I never forgot that moment. I could relay the entire conversation to you yet today. And it began really an opportunity for us here at the endowment to support the work of peers in our community, and to really look for opportunities on how they can add an extra layer of support to mental health wellness in our community. And so this particular community conversation is just very, very important to me. It's very exciting to me, and I'm so glad I get to stand here and introduce these folks to you today. So we're going to be talking about peer support in our community and how it adds to our mental wellness overall among all of us, not just those who are struggling. I want to introduce to you today our moderator of the panel, Patrick Kreifel. Patrick is the regional administrator of Region 5 Systems, who is the behavioral health authority for 16 counties in southeast Nebraska. He's going to be leading us through this conversation with some very important folks, and I'm as excited as you are to hear what they have to say. I'll turn it over to you.
Thank you, Lori. It's a pleasure to be here, and I have always enjoyed our relationship with the Community Health Endowment and everything that you do for the community. So thanks for having these folks here and having this conversation with us today. Appreciate it. So I want to just start off with just reading a little bit about peer support and just kind of laying the foundation for our conversation today. And then I'm going to introduce the panelists, the experts, the people that live and breathe this every day. A peer support worker has lived experience of recovery from a mental health condition, substance use disorder, or both. These individuals utilize their valuable experiences and training to provide support to others experiencing similar challenges. Increasingly, peer support offers an additional layer of mental health support in Lincoln that is culturally responsive, decreases stigma, and mutually beneficial. Over the last decade, Lincoln has seen a significant increase in peer support services. This community conversation will provide a brief overview of peer support, the evolving landscape of these services in Lincoln, and inspirational personal stories from peer support employees and the individuals they serve. So thank you for joining us to learn more about the lived experience and a transformational component of improving mental health and wellness in Lincoln, Nebraska, and our southeast 16 counties. So I want to start here with introducing our panelists, and I appreciate all three of you joining us here. So first, to my left, we have Tessa Dominguez, and she works with the Mental Health Association of Nebraska. And all three of these organizations are peer-run, and I'm sure they're going to talk a little bit about that here in a bit. And next to Tessa, we have Chris Allende, and he is with Wellbeing Initiative. Thank you, Chris, for coming. And Jennifer Burks at the end here with Families Inspiring Families. And Jennifer brought a friend with her, and that's Doretta Brookins, and she's in the audience and available to help answer questions if we need her. So let's Tessa, can we start with you? Is that all right? And why don't you talk to us a little bit about why you became a peer support specialist and just a little bit about your backstory?
Yeah,
and
absolutely.
maybe your role at Mental Health Association of Nebraska.
Yes. First of all, thank you for having us here today. So just a little bit about me. I think I'll start there because that really will lead into like why I work in peer support. I'm somebody that at a very young age experienced a lot of trauma in the home due to substance use and domestic violence. And that really impacted my life in a way that I feel like that my family could have never expected. So my mom moved us from out of that environment to southeast Nebraska, a small town here in southeast Nebraska, where I grew up. I come from a very loving, supportive family, but from a very early age, they could see that there were a lot of challenges and struggles with my mental health before I was even really old enough to understand what that meant for me. I had a lot of experiences that I thought weren't normal. I don't know what I thought normal was, but I didn't think that mine fell into that category. And I was really uncomfortable talking about those things with people, just out of fear, I think, of how they might perceive me or the experiences that I had. My family did what they thought was best for me at the time and really just turned to the resources that they knew of, which was a lot in the traditional mental health system. There were some experiences that came out of that for me that were really good and beneficial and helpful, and then some that were not so much. And so through that journey, I started to receive diagnoses, tried different medications. I spent some time at the Lincoln Regional Center, and I really, I thought that now that there's this name to it and I have this diagnosis, somebody's going to come along and they're going to be able to fix this, right? And I no longer have to experience life this way. And when that didn't happen for me, I think I found myself to be pretty hopeless because I thought if the doctors and, the therapist, and if they didn't have the answers that how was I supposed to help myself in this way? So that I started experiencing with substances at a pretty young age because that really numbed out a lot of those really uncomfortable feelings that I was having. And that led into nearly 20 years of addiction. It cost me a lot in my life. I had children young. It cost me my relationships with my family, my children. It cost me my freedom. And that's when I was incarcerated in York at the Women's Correctional Center there. And I was struggling. That was an environment that I really struggled in. I was struggling to complete programming. Parole was denying me the opportunity to go home because I was struggling in those areas and unable to do that. And that was when MHA brought WRAP, Wellness Recovery Action Planning, into the prison system. And it was their first time ever doing that. And so it was kind of like this test pilot. Let's see how this works in this environment. And I signed up for that with no really great intentions. I thought well, maybe if I can collect another certificate, the parole board will, see fit to give me an opportunity to go home. But when I got there, what I got was so not what I expected. And even though I'd been in this really hopeless place of not really knowing what life would look like for me post-incarceration, I thought I can go home and I can work on rebuilding those relationships with the people important to me. But am I ever going to be able to build a life for myself that I can take pride in? And I didn't feel that was probably possible for me. And when I got to this WRAP group, there was this panel of peers that had similar lived experiences as me, and they were doing really different things with their life today, and they had found a purposeful life. And that to me was this beginning of hope that I could do something different too. Through that group, I really started to learn about personal responsibility and how I could take control of my own wellness, whatever that looked like for me. And so for me, that was a combination of some of those things that I had received from the traditional system, along with peer support, and then just finding that purpose in my life and giving back. And that's what really led me into peer support work. So I was released in 2016. I came to work for the Mental Health Association at that point. I started facilitating WRAP inside the prisons myself, so that really felt full circle for me. And then I started my journey with them. I worked as a peer support specialist at Honu, the transitional living home there, supporting other individuals that were transitioning out of corrections. I've worn a lot of different hats for them. So I've also worked in the REAL program, which is peer support that works in collaboration with our local law enforcement. I became the Honu Home coordinator at one time, and now I oversee the our Omaha expansion of the greenhouse. We're trying to open a transitional living home in Omaha this time. But my journey didn't start there, like stop there. I was able to rebuild the relationships with my family. I have an active role in my children's life, my grandchildren's life. I get to be a positive role model for them and show them what resiliency and hard work can do for you. I've also decided to continue my educational journey. So I am a student at UNL with about a year and a half left on a business and law degree. And I've really learned that like the sky is the limit. Like there is no limit to like how far I can go, and I don't have to be defined by my past or the things that I've experienced or the things that I've done. And instead, like I get to find purpose and giving back to the communities that I've taken from through all of these new experiences that I get today.
Tessa, thank you for sharing that. What I heard you say is some of the adverse childhood experiences that you had as a child kind of took you down this path and was part of why some of your mental health or substance use kind of conditions came up for you in your life. And you're on the other side of that right now and in recovery. So thank you for sharing that. I want to come back to you about some of the things you said. So, but let's hear from Chris. Chris, welcome.
Thank you, Patrick. And also, I love hearing your story, Tessa. Thanks for sharing. It's always cool to hear it. So, like Patrick mentioned, my name is Chris Allende. I work with the Wellbeing Initiative as the Training and Technical Assistance Coordinator. My story is a little bit different in that growing up, I mean, I was born to a fantastic family. My parents are still together to this day. I feel they did a tremendous job. However, there were always challenges, and challenges continually arose. As a young person, had a lot of behavioral issues. I really liked to fight, to get into fist fights when I was a child. Some would say I was oppositional. Also was diagnosed early with ADHD, so I was all over the place as a kid. However, that through, I believe, at the time, medication, a loving household, and some really good teachers, quite frankly, I was able to maintain. I was able to do okay in grade school. However, at about the age of 14, I started making some choices and some decisions that would leave a lasting impact, and that was to start dabbling in drugs and alcohol. And for me, when I dabbled, I ended up diving in head first, and that led to a long road. For me, it was 10 years of substance use, of addiction, where, you know, I did everything under the sun, got into a lot of trouble, broke a lot of really solid relationships, severed friendships, hurt family, and did a lot of things that now I'm not proud of, but it's part of my story. Amongst those things was, again, incarceration. I was incarcerated for 13 times, the last time I counted. Experienced homelessness, was living on the streets for a while. And life was hard. Life was not good. I remember once when I had been kicked out of my parents' home because I was extremely disrespectful, using substances in their homes, and that's not something that they wanted as a part of their household. I was given the ultimatum of either changing your life or leaving, and I decided to leave. So lived on the streets for a while. That's when I experienced homelessness until I started living with a friend of mine. And I remember one day, I share this story often, we were up on a Sunday morning. It was probably 6, 7 o'clock in the morning. We had been up all night doing the things that you do when you're living that lifestyle at those hours of the night. And I remember sitting on his porch, and we were drinking a beer and smoking a cigarette and looking across the street and seeing a husband, a man, mowing the lawn in front of the house. And I would see a little boy about the age of my oldest right now, about 7 or 8 years old, riding bicycle up and down the street. And I would see his wife periodically with a basket of clothes, you know, doing the laundry. And I remember looking at my friend and saying, this life is not what life is supposed to be about. This is not what life is meant and supposed to be. That right there, that's what I want. I want that. But at the time, I didn't have the tools to be able to attain that until one day When I got in trouble again for the 13th time, arrested, I had been doing some things that I wasn't supposed to do in a company vehicle, and my boss found certain items that shouldn't have been in that company vehicle. And he came up to me and did something that nobody outside of my parents had done up until that point, and it was offer me support. And that's when I really learned the value of having a supportive network. And what he said, Chris, what you're doing, this is not okay. You're going to ruin your life, but I will help you. I will support you. And if you take steps to get better, if you go to treatment, when you get done, I will help you. I'll give you a place to live. You have a job. I will support you. And that offered the encouragement and the motivation that I needed to be able to take that step to get help. So I did. Born and raised in Miami, Florida, ended up taking the step to go to Hartford, Connecticut, to a faith-based residential treatment facility there called Youth Challenge. The program at the time was 18 months, so a year and a half. I went with the mentality that I'm going to be there 4 to 6 months. But throughout that process, ended up being touched. My heart was touched and changed, and I call it my process of restoration. So ended up going through that process of restoration, and things changed. Internally, but also externally. Not only did I finish my 18 months, but I stayed on board for an additional 8 months helping give back. It was an all men's program, so I was able to help give back to the men. What I say is I gave by grace what I received by grace, so I was able to do that. At that point, I had an opportunity, and it was to go to overseas and to go do missions overseas. So I was offered a chance to go to Guatemala and start up a residential treatment facility for men with substance use issues. So I went on a 2-year commitment, but ended up being there for 8 years, was the director of that home, and saw lives be transformed while I was there. And it was some of the most profound experiences that I've had. Addiction looks a little bit different in Guatemala, in my opinion, given the lack of access to resources. That's a whole nother story. But there was a lot to be said for my 8 years there. And when I was there, my wife and I had the opportunity to come to Lincoln, Nebraska, on another venture, on another mission. It was to support a church here in town. So simultaneously, while we were doing that, because we made the decision to come, we were, I was also simultaneously working as the office manager for an interpreting firm. I also do Spanish-English interpreting. And when I was at this event that I had heard of called it was formerly called Project Homeless Connect, now called Project Connect Lincoln, I was really impacted by the work that was happening here in this community, and quite frankly, the way the community works well together and plays nice together. Folks and resources really collaborate very well, and that's something that I'm really proud of this community. It basically just put that desire back in me to get into the behavioral health care field. So I took a position at a local nonprofit here doing this thing called peer support. And at the time, and for the first 6 months, I really couldn't explain what peer support was. I just knew I was helping people. I was supporting people, but I couldn't really articulate it. So I've been doing that for, again, 6 years now. For the last 3, I've been with the Wellbeing Initiative. Currently, my position is Training and Technical Assistance Coordinator. So I'm able to train individuals that are learning to be peer support specialists and gain their statewide certification in that. They're CPSS, Certified Peer Support Specialists, as well as through TA, able to support organizations that are looking to implement and sustain peer support as part of their service array. So right now I'm living my dream, y'all. I'm doing what I love to do, building leaders, supporting communities, and empowering individuals and instilling hope. Love it.
Chris, thank you. I heard a little different story than Tessa's. You know, I didn't hear much of the adverse childhood experiences. Correct. But I heard you talk a little bit about some of the behavioral challenges maybe you had as a young person, but not because of the environment. Right. And then you moved forward and really got involved with substance use. That's correct. And that changed your pathway a little bit. And now you're in recovery, living in recovery, working your recovery, yes, sir. And on the other side, in this peer support professional environment.
That's absolutely accurate, yeah.
I have a few more questions, but before I get into that, let's meet Jennifer. Welcome, Jennifer.
Thank you. I'm Jennifer, and I work with families, inspiring families. Mine's a little different also. So my daughter has mental health issues, and go back a little ways, I guess. I lived in a kind of a similar home to Tessa. Mine wasn't the best home, though. Both parents were were addicts. So I kind of knew, by both sides of it. But my daughter was struggling. She was getting kicked out of school all the time. So they gave me a advocate myself through Families Inspiring Families, which was Doretta, to kind of walk through the CPS system, because I ended up calling CPS on myself. About a year, they're about to close my voluntary case, and then I called and told them I had been using drugs the whole time on my voluntary case. So then I lost my kids, and that's probably people's rock bottom there, but sadly enough, that wasn't mine. I had to get incarcerated to realize that was not the life that I wanted to live anymore. After spending 5 months in jail, finally adult drug court here in Lancaster County picked me up. I completed that program and gained custody of my kids back in 2018. So I was looking at some big drug charges then. They did make those go away when I graduated in 2021. So then I was actually able to take the training through Wellbeing Initiative to become a peer support specialist, and then just to have Doretta walk with me to I don't know if anybody's ever been to a CPS meeting, but sometimes they can be hard to go to if you don't feel like anybody's on your side. It's really hard. So to me, peer support's really important, because I never want anybody to feel like alone and that they don't have somebody in that time of crisis, to be at 2 or 3 o'clock in the morning and not knowing what to do when your child is destroying your home, or you call LPD and sometimes they don't know what to do either. I know now they came up with the 988, and that's very helpful. I know we give that to a lot of our families that come in that are struggling with that same situation, because not all of us can answer the phone at 2 or 3 or 4 o'clock in the morning. But I know mental health is a real thing. I know trying to explain it to your younger kids is difficult. I know I tried to explain to my child. Once you take the medicine, I felt like I was magically healed, and then I stopped taking it, and then you have the same issues that you had before. So I know that just having an advocate and having peer support with you to help you is a really important part of my life, and that's what I do now, and I actually love what I do too. So,
Jennifer, thank you for sharing that. I wanted to just ask a couple clarifying questions. So when you say CPS, could you tell us what that means?
So it would be like losing your kids to the state of Nebraska.
Like Child Protective
Child
Services?
Protective Services. Yep. Sorry.
Okay.
Yep.
Okay.
So there's a hotline that you can call. So I had actually called Doretta and told Doretta that I had been using for the year.
So you had a similar upbringing to Tessa's, is what I heard you say, and you had some adverse childhood experiences, and then you began using substances yourself. And as a mother, parent, you saw how that was impacting your children, and you had a voluntary case, and then you got involved with Families Inspiring Families, who you now work for.
Yes. Yep.
Okay. Interesting. So all your pathways are a little bit different, right? So we had peer support in the child protection and services arena in the state here in Nebraska. We have it in the jails. I heard you say that, Tessa, is how kind of you got influence. And then Chris, you were in the community and in recovery already, and kind of got exposed and thought, this is unique, something powerful that I want to pursue. So I want to talk a little bit. First of all, I want to remind everyone that's live joining us for this conversation that you can put questions for the panelists in the Q&A, and you maybe have already been doing that, and you're welcome to do that. We're going to try to get to some of those questions. And before I ask a couple questions that came in early, I want to just clarify a few things. So Tessa, you talked a little bit about Wellness Recovery Action Plan. Will you explain to the audience what that is?
Yeah, so WRAP, or Wellness Recovery Action Planning, is a peer-facilitated group that really focuses on well, it's based off of 5 foundations. So it's hope, personal responsibility, self-advocacy, and support. And when we talk about that, like when you go through this group, it really kind of puts that focus and that power back into you as the individual. So it asked me things like, instead of the focus being on like, what do I look like when I'm not okay, and what do I need to do in those moments, the focus was really shifted to like, what do you look like when you're well? and what kinds of things help you feel well? And I don't know that like prior to that, anybody had ever asked me that question. I hadn't really thought about, you know, my wellness in that way. I had always thought like, well, I know when I'm not okay, and I know that I need to take action. But to really shift that focus to being preventative more, or more proactive, I guess, rather, and looking at like, what do I look like when I'm well? What kinds of things keep me well? How do I, I almost structure my daily life around that idea of wellness? Like, what things do I need to implement into my daily life to keep me on this course that I'm on, and to help support me from having to have some of those experiences that I've had in my past? And then it does take it a little bit deeper. Like, what are some early warning signs that you're not doing so well? And for me, like, I didn't ever recognize that there was early warning signs. I was just like, well, I'm either okay or not okay. And when I really started to dive into it, and with the support of peer support and those supportive relationships where I was able to really like kind of self-discover some of those things, I realized that there were some earlier warning signs that I wasn't doing so well. And when I was able to recognize those, then I could put a plan in place. Well, if I start to see those things, what am I going to do? So there's a lot more to it than that. I mean, we really get into like when things break down or when they get worse. We also do a crisis planning, which was really beneficial to me because it gave me the opportunity to put a plan in place. So when I'm not okay, there was a plan there to support me, and the people that were in my life as a part of my support system knew very clearly what their role looked like and had the opportunity to agree to be that role in my life. But yeah, I think the biggest part about it for me was just that idea of like building a healthy support system. What does that look like? What is healthy support, and what does that look like? And that nobody was going to come along with a magic wand and fix me. I had to start taking action myself and really looking at what my part was in this and what could be my personal responsibility.
So this Wellness Recovery Action Plan that you speak of, and you've said it so eloquently, that is a tool that was created by, is it Mary Copeland?
Yep, Mary Ellen Copeland.
And it's a tool that wasn't just made up. It's been scientifically tested to demonstrate results.
Yes, it's an evidence-based practice. They've done studies that show that people have been able to obtain and maintain wellness for long periods of time when they actively use this plan in their life. The other great part about it is that it's a living, breathing document, right? Like, it grows and changes as I grow and change. So it isn't static. It isn't a one size fits all. It really is like, as I evolve as a person, my plan evolves with me.
Very nice, very nice. Thank you. Thanks for sharing that. I want to just touch on one point here with the panelists and with the audience. So when we talk about peer support services can effectively extend the reach of treatment beyond the clinical setting into the everyday environment of those seeking a successful, sustained recovery process. So we're not looking to replace any of the therapeutic interventions. Chris, do you want to talk a little bit about that?
Yeah, absolutely. And I think you said it very well. We're not looking to replace any type of therapeutic interventions. We're looking to work alongside a team of providers, for example, to be able to support individuals in ways that maybe a therapist can't, potentially. One of the things that I like to talk about when we're training individuals on becoming peer support specialists is that peer support is unique in that it can work with individuals before, during, and after formalized services. And we also work along the continuum of, intervention, postvention, prevention as well. So, and that's I'm glad you clarified that, because oftentimes there is maybe this thought that, oh, but you're not a therapist. And we never claim to be. The work that we do is different. It's a work based on mutuality. It's based on reciprocity. You were talking about evidence-based practice. Peer support is also an evidence-based practice, that when individuals come alongside with somebody with lived experience, the results are there. We're able to support people in other ways. So I'm a huge proponent for having peer support in connection with other types of services as a kind of holistic approach to the individual, to support people holistically in that way. So, yeah.
So peer support services, what I heard you say is that they can occur before someone who maybe is in pre-contemplation stages of
Correct.
change, or contemplation, I'm contemplating to have a problem, peer support can occur there, or they can occur concurrently
Yep.
with a traditional medical service or a therapeutic behavioral health service, or aftercare. After maybe when I'm in the maintenance stages of change. Peer support can occur anywhere along that continuum, is what I heard you say. Okay, thank you. Very nicely said. I appreciate hearing that, learning that. So Jennifer, you talk a little bit about 988. I wonder if you could expand for the audience a little bit about what 988 is, and I'm sure these other folks here will help fill in the gaps. And then what's the connection between 988 and your peer support program at Families Inspiring Families? How does that work?
So my understanding of 988 is, so if you have a child who is in crisis, or a family, you don't even have to be a child, if your family is in crisis, or having any suicidal ideation, suicide, threats, or wanting to harm themselves, and if you're really, really concerned, or you don't have to be really concerned, if you're just needing help, right, you dial 988 and they can send out a crisis response team and a therapist, I believe. If you're needing a therapist, they'll come out, they'll decide, they'll help you walk, through the crisis that you're having at the moment, so you're not alone. I know personally, I gave a 988 out to quite a few families that I have, just because, it's suicide or suicide ideations and them wanting to harm themselves is scary enough, let alone, so if they say that their kid have ever said that or anything like that, I know that's something we have a spreadsheet on that we watch, and we check in with them to make sure they're not having, any of those be in dangers or whatever, So, and I think 988 makes it to where you don't have to call the police right away. Instead, you can get a licensed therapist, if I'm correct. I think, hopefully I am, but yeah.
Thank you. So, does anybody else want to add to that? Chris, you look like you want to say a few things.
No,
So.
I'm chomping at the bit. Yes, absolutely.
Thank you,
Just
Jennifer.
to build on what you're saying, Jennifer. So in our community, we have, if there's a problem with somebody breaking the law, for example, or if somebody is hurt, or if there's a fire, you call 911, right?
Okay.
So 911 would be for law enforcement, for the fire department, or for EMS. So what's unique about 988 is that it's for anybody who's having a self-declared mental health emergency. So if you're having a crisis of sorts, and it doesn't even need to be for suicidality, if you're having a mental health crisis, instead of calling 911, you can call 988. And it's excellent. If nobody in the audience has called, I would encourage you to call. Typically when you do, there's a couple of options, and the times that I've called have been connected with an operator within about a minute. So that's good to know. And typically the options are, if it's English or Spanish, if you identify as being a veteran, or if you identify as being part of the LGBTQ plus community. And if you do, then your call gets routed to a specific operator. And basically what happens is you have a crisis counselor on the line who will be able to have a conversation with you, see what your needs are, see what your crisis is. Many times those crises can be mitigated right there on the line. The crisis counselor is trained to figure out what the issue is and put some kind of interventions in place to support you. However, if you feel like you would like some more immediate support, then they have crisis response and mobile crisis response units that can go out to you wherever you are and engage with you, which is fantastic. And this is all through the state of Nebraska. Every region, in our case, Region 5, so southeast Nebraska, those 16 counties, work with different providers to be able to reach all areas of those 16 counties. So you don't necessarily have to just stay on the phone. You can have a live person. Oftentimes, it's a team of peer support and a therapist that go to you and support you with whatever your needs are at that time. And can also connect you to ongoing services to help reduce those crises.
What I hear you and Jennifer saying is 988 is different than calling 911. Mm-hmm. And that's a national number, 988. So you can be in any state in the United States and call that number. And here it's routed through Boys Town.
Correct.
And it could be, Jennifer says, because you're feeling suicidal, or maybe you're having some behavioral health challenges, with your youth, or substance use challenges with your youth and your family, or self-declared. I heard you say it could be a self-declared challenge, and you can call that. And they will help triage and help you kind of decide if it's a referral that you need or if mobile crisis response should be activated. I heard you both kind of talk a little bit about that. So that's someone that can go out to their home, and it could be a therapist, could be a peer, or help the family de-escalate the crisis. Is that right? And work through that. And then peers will be there along with them to try to help them move forward in that recovery. Okay, thank you. Thank you for explaining that. And you oftentimes, Jennifer, your agency gets referrals from 988 families specifically.
Yep, and then the Nebraska Family Helpline, LPD, other agencies. We get a lot of LPS.
Referrals. Okay. So I want a couple other things, and then we're going to get to some questions here soon. I want to talk a little bit. I've heard about different groups, like SMART groups. Chris, are you familiar with SMART groups, and could you talk a little bit about that?
Yeah, absolutely. So SMART Recovery stands for Self-Management and Recovery Training. It is based on this thing called CBT, which stands for Cognitive Behavioral Therapy, but specifically a branch called REBT, which stands for Rational Emotive Behavioral Therapy, which basically the concept is rational, the way we think, emotive, the way we feel, behavior, the way we act. So what we do in SMART Recovery is if we can support individuals in changing how we think, the thought is it'll change how we feel, and if we can change how we feel, it'll change how we act. So it's a fantastic support group, which I personally love. I'm a facilitator of SMART Recovery. Every Tuesday at 1 o'clock, we have a group here in town that's also hybrid. And we work a variety of different tools that help us to do just that. We work things like a cost-benefit analysis, for example, but in a very unique way. It's a cost-benefit, the cost of using versus the cost of using and not using versus the benefits of using and not using, which is a different take on that, and we get to compare those things. We do things like lifestyle balance pies, hierarchies of values, things of that nature, the ABCs of SMART Recovery. It's a fantastic alternate route to recovery, and it's probably the most popular model outside of 12 steps on a global level.
It's peer run, though.
It is. That is correct.
So that's where it adds layer on. So wellness recovery action plans, and we have these SMART groups.
Absolutely.
That are all peer run.
Absolutely.
So one other thing, and then we're going to keep moving here, but one other thing is, could you three, one of you, and talk a little bit about that peer support training and certification process?
So we actually both of our organizations use two different trainings, so I think that we could probably both have a lot to add to this. Our organization uses the intentional peer support model, which is a model that is used nationally and internationally. And that model is based off of 3 principles and 4 tasks, and it really, we really look at like connection, mutuality, worldview, and moving towards. And it's all about relationship building. And when we are able to build these relationships through peer support, and we're coming into this shared space as equals and learning and growing together and taking this journey of recovery together, we learn how to show up differently in relationships than maybe how we've historically done that. And that affects all areas of our life, right? That affects me as a parent, as a daughter, as a coworker, as a student. And it definitely can also be beneficial in service type relationships. And so, so that training is a 40-hour training that then you are certified in intentional peer support. That with that training, we train our staff at MHA. We've also trained nearly 200 incarcerated individuals in intentional peer support and facilitate that within the Department of Corrections communities at 6 different facilities. And then I think, Chris, I'm sure you have a lot to add to that as well, because you guys do the state certification. So.
Yeah, it's a different process, both excellent trainings. So ours is one called the Periodical Nebraska Peer Support Training. Basically, the state of Nebraska's Division of Behavioral Health, a specific office within that division, the Office of Consumer Affairs, came up with 13 domains that they wanted included as a part of the peer support training based on SAMHSA, which is the Substance Abuse and Mental Health Services Administration. It's a federal division, I guess, if you will. They came up with these 13 core domains and that are included in our peer support training. So we're one of, I believe, 3 trainers that train individuals to become state certified peer support specialists. And it's a little bit different in that it's a 60-hour course. 20 of those hours are self-paced online, and then 40 are face-to-face. Upon completion of that training, which we recommend not just for folks that want to become state certified peer support specialists, but anybody who truly wants to enhance their recovery. The way I like to explain it is that through that training, we teach folks on how to use their lived experience to support others on their recovery journey. However, the benefit of it is, one of the benefits is that when you do successfully complete the training, you're able to use that certificate of completion along with the other information that the state of Nebraska requires and submit for your CPSS, which is your Certified Peer Support Specialist. There's a test, like most certifications happen in our state. There's a test that you take, and once you successfully pass that test for the state, you get those 4 letters behind your name, which some people think is cool, and then you're also able to bill for services. Currently, you're able to bill Medicaid and the regions.
So what I hear you both saying is there's curriculum
Yes.
that is behind becoming a peer support recovery specialist within our community. And there's competencies that you have to obtain through the training to become certified or approved through your organization or through the state to deliver the service.
Correct. And I would add, Patrick, that upon getting your CPSS through the state of Nebraska, there's also a continuing education requirement. So you do need to have 20 CEUs, continuing education units, every 2 years, with 14 of those being within the 13 domains of peer support and the other 6 being in ethics. So there's a lot of continuing education that also happens for the state test.
So peer support. Oh, I'm sorry, Tessa.
You're
You,
okay.
no, you. Go ahead.
I was just going to say then, like similarly to that, ours is a little less formal. So we do refreshers or renewal of that certification every 2 years is the best practice with that. And then like our continued education and learning happens through co-reflection, which is a common part of our practice.
So it sounds like when I hear you describe peer support and some of that curriculum and some of the competencies and some of the certification, that sounds much like what doctors or therapists or nurses kind of go through. They all have curriculum-based training and they have competencies that they achieve, and so it's similar and different.
In some ways, yeah.
Yeah. Okay. So one question that came up in the queue that I did want to, seems related, is, and Jennifer, maybe we can start with you on the end here,
Okay.
and we can let the others answer as if they feel like they have something to add. But are peer support workers paid or are they volunteers?
So we're paid. I don't know if anybody else volunteers, but we're paid to work. So what it looks like when we get a referral. So I get a referral. We have a certain amount of time to call the family, and then we call them and we try to meet them where they're at. So if they can't meet until 5 or 6 o'clock at night because they have a busy schedule during the day or whatever, we'll try to meet them in the evening or on the weekends if I need to. And then we just do an intake, and then we meet with them and help work the goals that they've came up with.
Self-directed is what I hear you say when you work with a family. They direct the goals.
Yes,
Okay.
very much so, yep.
The only thing that I would add to that is that there's definitely space for volunteers in this work as well. I know our organization does work with a lot of volunteers. I'm sure you guys do as well. So, I mean, it can be a paid role. It can also be a volunteer. And for some of us, like, this has become our career. Like, we we want to be valued for the experience and the skill set that we bring to the table, and it has become like this is our profession, this is our career path for a lot of us.
Agreed.
Seems like you all got involved because of some of your personal challenges that you described when we first opened, but then now it's evolved for all three of you as paid positions, and you're helping others in the community in their recovery journey, whatever that be, along that continuum. Okay, thank you. I do want to talk a little bit. So how can others, let's say there's others listening to us here today, and they want to become a peer support specialist in any of the 16 counties or across the state of Nebraska. Where do you start? How does someone get involved with your organizations or just in this community of peer support recovery, this service, if you will?
So for us, like we do, because we do use a different curriculum, we offer that training to all of our staff once they're hired. So if you're interested in becoming a peer support specialist for the Mental Health Association, then after you've applied and been hired, we would put you through our training. But I think like there are so many, like peers are really becoming diversified in the community, and we're seeing them in a lot of different spaces. I don't even know that I could tell you that I'm fully aware of where all of them are, because we are seeing them in so many different places. They're in the hospitals, they're with other organizations, we work in collaboration with the police department. Like there's just a lot of different spaces where that where you can find that. Yeah.
I would add, typically if somebody wants to become a peer support specialist and they want to get trained to become certified on a statewide level, I usually have them just reach out to me. I have a template email that I would send them that has both pathways that we offer, because we actually offer 2 pathways to become state certified, which I can explain if you want those details.
Yeah, please share with us a little bit,
So
Chris.
the one that I manage would be our traditional pathway, which is the one that I mentioned before, those 60 hours. But we also have another one that we call our enhanced peer support training, which is a little bit different in that we have 2 cohorts a year. So one in January and one in July. And a colleague of mine, Tasia Brummagem, she manages that one. And basically what would happen through that one is that folks would register, you would get accepted, and then instead of doing 5 business days, let's say 8 hours a day, it would be over the course of about 12 weeks, where you would meet once a week for 4 hours. Upon completion of those 12 weeks, then you would have a practicum that you do, which is 50 hours. And there's where you put all that learning that you did into application. We would usually connect you with an organization that's doing the work in your given community, and you're able to do those 50 hours of practicum. And what makes that one extra cool is that you're getting paid to do it. So there's a stipend that's being offered over the course of those 6 months for $5,000. Which turns out to be about $800 and something a month that you're actually getting paid while you're doing the learning for cost of living. So I would send you a template email that highlights those 2 pathways. You would choose which one best fits your needs, and you would apply. And then if it's mine, I would reach out to you. If it's Tasia's, she would reach out to you. And basically we would go through the training process. Once you're trained, well, then I would, if it's with me, I navigate all what it looks like to go through your certification process. And that's the training. Now, I also want to say that there's many spaces, like Tessa was saying, for being able to apply that learning outside of the formal process. But I also want to add, because you mentioned, what if there's an organization that's looking to do peer support? Another part of the work that we do, the Wellbeing Initiative, is we offer a lot of technical assistance within the state of Nebraska and abroad to organizations that are looking to do just that, implement peer support as a part of their service array and make it a sustainable service, because it absolutely is a sustainable service. So we would walk them through what the process looks like of adding peer support as a part of their array.
I'll just also add, as you were speaking, it made me think about, the curriculum that we offer, if you're not a volunteer or an employee with our organization, you can sign up through the Intentional Peer Support website to do their trainings there as well, because they do offer that like nationally and internationally. They do have a lot of Zoom options and that type of thing as well.
Thank you. Jennifer, anything you want to add? Or?
You'd have to ask Doretta. I don't know that.
Just call us.
So you can basically call any of these 3 agencies to get involved in peer support, is what I'm hearing you all say. And
absolutely,
there are other agencies within the community I mean, I heard you three say that I'm not even sure I'm fully aware of where peer support is throughout our community. It's in the hospitals, it's in the jails, it's with the police, it's with service providers,
Yep.
and it's within your agencies who are peer run, but it can be layered across. It could be in a primary care setting. That's great. Thank you. So I think we know how to get connected, and I know the Community Health Endowment will also send out information after this call if we don't get to all the questions. But I want to get to a few more questions here. So one of these questions here is, are the teams that respond to 988 trained in cultural competencies, and how are different language barriers addressed? Does anybody know the answer to this question? If you don't, it's okay, but anybody want to take a...
I'm not sure.
So I'm not 100% sure. What I do know, being an interpreter, particularly Spanish, English, is that it's challenging finding a variety of languages that are represented within the behavioral health care field. That's, in my opinion, a gap that we have, is having a variety of different languages. There are some cultural centers here in Lancaster County specifically that are doing a tremendous job of training community health workers in peer support, and then allowing them, the freedom to go into their own communities and do the work that they do. So I add that because it's not necessarily through the crisis response, but there's a lot of good work that's happening through the community centers that are providing culturally appropriate peer support to the residents of their communities.
So what I heard you say, Chris, correct me if I get this wrong, please, is that there are peers that are doing maybe these wellness recovery action plans or other peer support activities in the cultural centers, like the Asian Center. I know that I believe they trained 10 individuals at the Asian Center on wellness recovery action plans, and they are an integral part, and that's just one of many cultural centers here, the integral part in helping this community respond to the diverse cultural needs that maybe are presented.
Yeah, I would add that I personally have trained staff of the 5 cultural centers that we have here in Lancaster County to do peer support within their respective communities.
And could you name those for me, Chris,
if
you can?
Yes.
So we have the Asian Center,
the Asian Cultural Center, El Centro de las Americas, PONCA, Good Neighbor Center, and Center for People, I believe.
Okay.
Oh, and Malone.
And the Malone.
Yes.
Okay. The African American community.
Correct.
Okay. All right.
So,
Great. All right. Thank you. So let me think here. I've got several questions that are coming into the Q&A, and keep them coming. And if we don't get to them, I just want to remind you that we will get responses out to you, and the Community Health Endowment will help facilitate that with the support of the panelists. So they'll rely on the panelists to help respond to some of those questions. So peer support is an evidence-based practice. It is scientifically proven to get results. What are some of the results that you believe are achieved by peer support and offering this in our community? Let's start with you, Tessa.
Can you say the last part of that again?
Well, so what kind of outcomes, I think, or, since, it is an evidence-based practice, I think is what we all agree upon. If I misspeak, you all correct me.
Yeah.
And it is scientifically proven. I mean, this isn't made up, right? I mean, there's a curriculum, there's competencies, there's a specific approach. We have the Wellness Recovery Action Plan, SMART groups, there's other groups that we're not going to be able to get to today.
Right.
And what is the impact? What are the outcomes that peer support is realizing within our community?
So I think, and maybe some of this relates back to your previous question even, but in peer support, we are asked to be curious about what other worldviews might be. We learn how to hold multiple truths, how to make space for differing perspectives from our own, and that they get to exist in the same space, because what we really are is, like I said, curious to understand how you've come to see things the way that you see them. And through these peer support relationships, as we're connected to one another and we're exposed to different lenses and different perspectives, our own lens broadens, and the way that we then interact with the community, our families, other providers. Like I said, like it really just becomes a way of life. It affects all relationships in my life. And as that broadens and I learn how to have mutual relationships, then organically we start moving towards what it is that we want to see, where it is that we want to see this relationship go. And I think that through that, like we're just creating safer communities. We're creating more supportive communities. Yeah, I think that really like the impact that one person can have is like the pebble in the pond, right? And then it's that ripple effect. And because we're in so many different spaces, we're starting to, we're seeing peer support inside the prison systems, inside the jails, inside service providers, but also within the community. Like each one of us is a pebble, and we all get to have that ripple throughout our community as we start to learn how to show up differently in our lives.
Other thoughts about the question?
Yeah, so there's 3 areas specifically that I want to talk about as it relates to outcomes. The first one is recidivism. And when I say recidivism, that means the revolving door that sometimes happens with justice-involved individuals and incarceration, so people getting locked up. And oftentimes when we see the data, we see that working along with a peer support specialist helps reduce that. It helps reduce recidivism. So people do not get incarcerated as much when they're walking along with a peer support specialist. I don't have the numbers on me, but there's many studies.
So what I hear you saying so far, and I know you have more you want to say, Chris, is peer support impact people not returning to jail.
Correct. And
because of their mental health or substance use condition.
Correct.
Okay. All right, that's
Correct.
good. Keep going.
Which, by the way, and I'm just going to throw this out there, in my conversations in my previous role, I had dialogues with the 16 sheriffs and jail administrators of Region 5. And on average, according to the jail administrators and sheriffs, 85% of the residents of their county jails were there because of directly related to a mental health and or substance use issue. So peer support helps with that so that people do not get incarcerated.
So what you know in Southeast Nebraska
Correct.
and through your conversations is that there are approximately 85% of individuals that are in jail because of a mental health or substance use condition.
Correct.
And you all, the 3 of you, and your agencies are trying to impact them not returning to jail and helping them move forward in that recovery journey.
Yes.
Great.
Correct.
Did you have more you want to? You
did.
got more.
I
see
do.
it.
2 more points. I also wanted to talk about hospitalization. So it helps reducing hospitalization for mental health crises. I know here our very own MHA has a hospital diversion program, the Kea House. Am I saying it right now?
It's a respite house.
The
Kea House.
Fantastic. So we have the Kea House and programs such that really help and support individuals that, again, maybe have been hospitalized due to mental health crises. Walking alongside a peer support helps reduce hospitalization.
So the second point that I hear you and Tessa talking about, the services at the Nebraska Mental Health Association, is the hospital diversion.
Mm-hmm.
So if I'm feeling suicidal or isolated, and I can go to the Kea House instead of going to the emergency room. Correct. And that, and it's not to replace the emergency
Correct.
room, but it is a place where I can go amongst peers. And
So hopefully you're utilizing the Kea House for crisis,
Yep.
right? Like hopefully you're recognizing like I'm struggling and I could really just use some support right now. And the Kea House is that option for you to go and get that support. But because it's not a locked unit, like a locked facility, you can come and go as you please. So you can still go to work, take care of your pets, like all of those daily life things that are important for us to be able to keep up on, and we don't start to lose those things that we've worked so hard to build for ourselves. And so the Kea House is a great place to do that. It's 24-hour staffed with peers. So it doesn't matter what time of day or night it is, that support is there for you.
365 days or 366 if it's a leap year.
Right.
They're open? Okay.
Yes.
All right. So, don't return to jail. Peers can impact that, and not going back to the hospital. Peers
Correct.
can impact that. And you have more.
I do. One final point, and it's sustained housing. So oftentimes if housing becomes an issue, and for some of the folks that we walk alongside, housing is an issue and they need supportive type housing. So it's also been shown that peer support is very beneficial in supporting individuals and maintaining their housing, particularly individuals that have a past maybe of experiencing homelessness, whether sheltered or unsheltered.
So peer support can also impact people's basic need of being housed, so they don't become unhoused.
Correct.
Okay. All right.
And I would also add with the court system then, so like, you know, if you have a child protective case or whatever, even, you know, it was very helpful for me to have Doretta walk with me, because, you know, it could be scary going into the courthouse not knowing what's going to happen. So if you have somebody that's been there with, you know, through kind of similar things as you, it's easier to help you. Also with school too, I know a lot of the referrals that we get are for kids having troubles in school. So, you know, some parents, an IEP meeting could be, you know, really scary to go to by themselves. So having somebody that's been through that go with them makes it, you know, easier a little bit for them.
So the peer support that you're talking about, Jennifer, is really advocating for parents and also helping them stay connected and engaged with their children. And you have to advocate for them to do that, is what I hear you saying.
Yes.
And you do that by walking beside them through the journey, going to court with them, going to team meetings with their caseworkers, which sometimes is very intimidating for a parent. I imagine that would be very scary.
Yeah.
And you're kind of that consistent person as a peer, walking through that journey with them to help them achieve some of their self-directed goals.
Right.
Okay, very nice.
Right?
Tessa, yes,
So
please
I want
talk
to
to
go
us.
backwards a little
Yeah.
bit to a question that was brought from somebody in the audience, and I apologize. Sometimes I'm a processor, and it takes me a minute to kind of to think about some things. But the question was asked about with 988's response teams, if they were trained in like cultural competencies. And I wanna just point out one thing. So I'm not as familiar with 988 as I'm sure some of these others on the panel are. But one of the things that I heard them say is that with that response team, it is often like somebody from like your traditional mental health service and peer support, correct? So one of the things that I want to point out is that as those peers are trained, one of the things that we look at is in peer support training is taking a look at ourselves and where we have held privilege and power in our life, and also where we have experienced oppression. And as we're doing that self-reflection and acknowledging like where those things have happened in our life and what kind of effect that they've had, we're also looking at like how that shows up in our relationships and how it affects the way that we connect with people. So I think that some of those things that are being asked about and maybe it like are somewhat already entwined into the peer support training. And just our ability to show up curious and self-aware and just open to hearing other people's experiences. I think that in order for me to validate your experience, I need to believe you, right, as to what it is, and to be able to walk through that and give you, like, create this safe space for us to talk about.
Appreciate you saying that, Tessa. I want to just take a minute to go in another direction. We're going to come back to some of the questions. We have more questions, but it makes me think about stigma. Mm-hmm. And I heard you say, well, there's multiple perspectives to situations, and we try to help people look at different perspectives. So can the three of you talk a little bit about stigma and what you're trying to do around that? What is stigma? What are you as peers trying to do to influence that?
That's a big question. It's a really big question. So stigma is this idea of these labels or perceptions that have been placed on people with similar lived experiences as myself or anyone else on this panel. So that might be this idea that maybe you understand or know what it is to have lived experience with mental health, incarceration, substance use, but yet you've never really experienced that. And so maybe the only thing that you really know about it is what you've heard on the news or seen on TV. And oftentimes our populations aren't represented the best in those spaces. The stories that grab attention are usually not, they're oftentimes negative stories about our experiences. And so the opportunity to break stigma is for me to show that, like, yes, this is a part of my life. Yes, this is a part of my past. I've had these struggles, but I'm still, like, we're all human. I'm still just a person, and I'm capable of so much more than this limited expectation that might be placed on me by society because of those experiences. I think that, like, one of the biggest things that we face, especially with, like, working with the corrections population and people coming out of prison, is that there's always this fear, right, that of danger or harm is going to be brought to your communities and your neighbors, your neighborhoods. And that is one that we face the most. That's very challenging and difficult. But I'm that population, and what I do with my life today is so different. Like, I'm a student, I'm a professional, I'm a mother, I'm a grandmother, I'm a homeowner. Like, I'm all of those things that all of your neighbors are. And this one part of me, this one piece of my past, isn't what defines all of the rest of those.
So I'm just trying to make the connection for myself, and I think for everyone watching, right? So the stigma piece kind of comes in. If you don't have that lived experience, you might have some belief systems that are negative about maybe someone who is unhoused or who uses substance assumptions. Yeah. And so what you're trying to do is instill hope and encouragement and advocacy for people who have those challenges or going through those, and that they can move forward, and that they're people first. I mean, is that absolutely. That they're a person first? They're not the substance user. They're not the mental health diagnosis. Mm-hmm. They're not the homeless person, right? They're a person who's having these life experiences. Is that kind of what you're saying? Yeah,
people are, as humans, there are so many different parts of us. We wear so many different roles. We've had so many different experiences, and it's so diversified. It's really, you really can't define any one person by one part of them, whether that's a past experience or characteristics. Like, we're just all so diverse. And I think stigma is this idea that we are defined by one thing, and that's the part of that we want to fight. And I'm sure.
Anything else you, Chris or Jennifer, you want to add to that?
Yeah, do you want?
No, I'm saying I agree.
So I would add, and maybe this is strong, but when I think about stigma, I think about, using stigmatizing language is kind of like portraying moral deficiency, or like kind of projecting a moral deficiency on an individual because maybe they have a mental health or substance use issue, that you're inherently saying that they are less than human because of that situation, which I know are strong words. I was recently at a conference that I heard somebody say, and I thought that this was fantastic. This individual said that they did a survey within their organization, and the survey got 100% results, which is exceedingly rare to get 100%. And the 100% result was that all recipients of the survey were human. And I thought that was fantastic. Every single individual that took that survey was human. We're human first. We're people first. And I think it really highlights what you were saying. I want to add to it. When you were talking about rap, it really struck my mind, because one of the things that rap helped me do, Wellness Recovery Action Plan, was changing my mentality from being deficit-based, what's wrong with me, to being strength-based, what I've got going for me. It's my wellness tools, not my coping mechanisms. I'm not trying to deal with what's wrong. I'm trying to make tools to be well. So I'm going towards wellness. And when I think about stigma, one of the main things is exactly what you folks are talking about, is that strength-based mentality. Like, when we don't even say substance abuse anymore. Now the term that's being used is substance use. And part of it is because, well, I was never abusive towards drugs, but drugs sure did beat me up, right? So it's not like substance abuse, but substance use. I'm engaging in that. So changing that type of language, putting the person before the diagnosis, similar to what y'all were talking about. Instead of, that homeless person, it's that individual that experiences homelessness. But in my mind, the root of destigmatizing is remembering that we're all people. And as such, we all deserve to be treated with dignity, and we all deserve to be treated with respect. Regardless of our life circumstance, whatever's going on, or whatever situation has arisen to get us in the position in which we are at that moment. We're all people.
A couple points that I heard the panelists talk about, and that is that language matters, and that we need to be conscientious and considerate about that. And the other one is strength-based. That's kind of a core foundation to peer support, is that we're not looking at deficits. When I go to the doctor, I talk about my problems, right? But when you guys approach them, you take this, well, what is working well? What are the positives that's working in your life? That's kind of your influence that you have on the system. There's a couple important questions here that I want to get to, and I hope people are enjoying this conversation as much as I am. I'm learning a lot, and I want to get to outcomes a little bit more, because I did some research before I came, because I knew I was going to be sitting with these experts, and we have about 15 minutes left. So a couple questions and right here, and then I want to talk about some of the research that I saw. So does the LPD, and I'm thinking that means the Lincoln Police Department, does the Lincoln Police Department or the crisis teams use individual WRAP, Wellness Recovery Action Plans, when they're called? Any thoughts on that?
Yes, actually. So we also participate and support the behavioral health threat assessment training that happens here for, I believe it's all 16 counties of Region 5. Is that correct, Patrick?
Yeah.
And it's a training that is done for first responders. So oftentimes, like being a part of that, we're also a part of the training with Lincoln Police Department on the day that they do their training around mental health and addressing those issues in the community. We've even been a part of doing like some of their role plays with new recruits and some of those trainings. One of the things that we talk about in all of these spaces is WRAP, right? And so we have this common agreement in our community that if you've gone through WRAP and you have a WRAP plan, that a place that you can keep that in your home is on top of your refrigerator. And our police officers are trained then that if they enter a home of somebody who's experiencing a mental health struggle or crises, that they can look there to see if they have a WRAP plan. And in that WRAP plan, in the crisis planning part of it specifically, we list out who our 5 top supporters are and their contact information. So there may be an opportunity there for us to call in, or for the LPD to call in one of their support people to be there to support that individual. It could prevent them losing their rights and being arrested. It could, because it might just be like, I don't know that it's okay for me to leave you alone right now, but like that could be the reason that somebody's taken to the crisis center or arrested. But rather than that, like we can call in the support person that can come sit with you and as you are walking through this challenge or this struggle. And they're very well adversed because they know what your crisis plan is. They know what their role is in it. They know who the other parts and pieces and people that might play a role in that as well. So it's just a really great benefit for our community to have.
So I'm hearing you say, Tessa, that those wellness recovery action plans are really important.
Yes.
And you're also, not only you guys are training, the 3 of you are training peer support specialists, you're training law enforcement officers, you're training other behavioral health people on understanding the impact of this so that it can divert potentially someone having to go to the hospital or having to be taken into emergency protective custody.
Correct.
And kind of, we don't focus on the emergency, we kind of be more proactive in planning. Chris, you want to make a quick comment, and I want to get to a couple more questions.
I did. Just a really quick comment about a lesser known resource. A couple of years ago, I can't remember when, but a couple of years ago, our legislature passed this thing, which I believe is LB 247, and it's Mental Health Advanced Directives. So mental health advanced directives are similar to the WRAP crisis plan, which now are a legally binding document that an individual can make before they have a mental health crisis, which in theory, law enforcement is supposed to adhere to. So the point being, using such a thing like your RAP crisis plan, following the steps that legislature has established to make that mental health advance directive per LB 247, and then again, if law enforcement contact happens because of a mental health crisis, then that is a legally binding document. And I know a colleague of mine, Lisa Dakota, is working very closely with Disability Rights Nebraska to disperse that information and train not only law enforcement, but residents of Nebraska as a whole to be able to use that resource, because it's underknown right now.
So not only do we have the Wellness Recovery Action Plan, but there are some legislative bills that kind of clearly define how to direct what you want to happen if you have a behavioral health crisis.
Yes.
Thank you for sharing that. So we're getting close to the end of time here. Before I get to this question, I want to the research that I did, I want to get this in for the audience. So I went on to the Substance Abuse Mental Health Services Administration, the federal government's website, and they talk a little bit about peer support and does it make a difference is the question. And this is what they said, and it's some of the stuff that the three of you have said. So they said it increases self-esteem and confidence. It increases a sense of control and ability to bring about change in people's lives. It raised empowerment scores, increases a sense that treatment is responsive and inclusive of needs, increases a sense of hope and inspiration, increases empathy and acceptance, and increased engagement of self-awareness and wellness, increased social support and social functioning, decreased psychotic symptoms, reduced hospital admission rates, and increased long-term community tenure, and decreased substance use and depression. So it does work, and I came in with that knowledge. So thank you guys for confirming that. Two last questions, and then we'll wrap up here. So is peer support limited in our community? Are there gating factors to having more peer support available in our community? What are your thoughts on that? Does anybody have any perspective that you want to share?
I can let one of you start.
So I don't want to be that guy, but I will be that guy. Funding is an issue. So that's something that always affects, particularly this year where our system lost a lot of money. I won't get on that, but that's a big issue. I feel like stigma is also an issue. I know that as an organization, we have been working very hard with a variety of sectors, from the nonprofit world through the for-profit world, whether it be law enforcement, whether it be hospitals. You know, we're now starting in Omaha to work part-time in an addiction unit as well as a liver transplant unit. So it's definitely spreading. I don't necessarily want to take the negative approach to that. It's a service that is becoming more spread, not just in the behavioral health care world. However, particularly in the behavioral health care world, I believe that one of the major issues is stigma, but then also a lack of funding is what I've seen.
One thing that I will add to that is that, unfortunately, in some occasions where peer support has been brought into an organization, there have been times that it's been brought in as kind of like a tokenism, because there is such this conversation around peer support. And the thing that I want to say is really important with that is that that it's important to remember that peer support is a valuable experience that we bring to these organizations, that we bring to these teams, and that needs to be recognized across all levels of the organizations that it's brought into. We, through our experiences, have a skill set that we couldn't be taught in school. That even though like my educational journey is important to me, there are qualities or skill sets that I have that I've brought into this journey, both professionally as a student, as a person, as a mom, that couldn't be taught to me. And so I think that it is important that even though we are peers and we come to these spaces with that lived experience, we are also professionals. And our experience is valuable, and we bring to the team something that wouldn't exist in that space without us.
Absolutely. It's interesting. Again, these are really big questions, Patrick.
I know,
They're
right?
hard. Well, it's the audience.
like,
They want to
big
know.
questions.
You guys are doing great, though, I think, at trying to articulate what I'm hearing you say is peer support is across different disciplines. And I also hear you saying that peer support should be at all levels of the decision-making process. And sometimes funding is an issue to getting peer support out. And sometimes there are service definitions. I think I've heard you all say that, where it has certain requirements. And sometimes when it's one person in a big organization, it could potentially lose the intention of the peer support model. Is that accurate?
Yeah.
Okay.
Yeah, that's Tessa earlier mentioned co-reflection. That's why it's really important, in my opinion, and I'm seeing our opinion for co-reflection to be a thing, particularly if there is a lone peer support specialist. There's this thing that we identify as peer drift, which is where a peer support starts using more of that clinical language, it starts acting in a way that doesn't necessarily align with fidelity to what peer support is, and starts assuming more of the role of other professional service providers. So co-reflection really helps folks to realign with the values of what peer support is. Because oftentimes peer support can create, and oftentimes does when implemented properly, a cultural shift within the organization and goes more towards what we would call a recovery-oriented, or I'm hearing now talk about recovery-conscious organization.
Very nice, very nice. So I got one last question, and then I think we'll wrap it up here today. Jennifer, I want to start with you, and then we'll go to Chris, and we'll end with Tessa. So just listening, spending this hour and a half with the three of you has been an honor and a privilege, so I want to say thank you. But I think hearing your stories and hearing the adversity that you've faced and the resiliency that you demonstrated and moving forward in your recovery, I think of you all as very brave, just hearing your stories. And what my question is for you is, do you think of yourself as brave, and why?
Yeah, I guess, yeah, in a way. I don't think a person not brave, I don't know. I know I've been through a lot, so
Yeah.
It would be hard to go through, because I could have given up a million times. So to not be brave and not making myself continue to, go through all the struggles and everything that I had to face in order to become where I am today. Yeah, I feel like that is a huge part of,
You think of yourself as brave,
yes.
and you recognize what you've done.
Yes.
And now you're sharing that with others in our community.
Yeah.
Chris, same question.
Yeah.
Do you think of yourself as brave?
That's interesting, because usually the word like tenacious or stubborn would be the word that I would use.
Right.
But brave is a good one also. I feel like there's a lot of lessons that have been learned, like Tessa was saying, from the School of Hard Knocks. And if there's any way that I can support individuals to maybe, find their path to recovery without taking as many bumps as I did, or even if they have, and just being able to inspire that hope, I feel like I've been given a story, and it's my responsibility to use my story for the greater benefit. That's the perspective that I take. So I appreciate it being called bravery. I kind of feel like it's my duty and my responsibility to make that impact, because I have a story that can make an impact. And I think it would be selfish to keep that to myself. So instead, I use it as a tool. That's the way I look at it, but I appreciate that. I would say yes.
Thank you. Tessa, I see you as brave. Do you think of yourself as brave?
I don't know that that's ever a word that I've used to identify myself, but I love hearing what you both have shared, because as I'm listening to you both, I'm like, maybe I am brave, right? Like,
Yeah.
I think the word that I've used for myself has been like resilient.
Yes.
Resiliency is one that comes up a lot. And like what Chris was sharing is that I've had this opportunity, that I've had this wagon of things that I've carried behind me that maybe have carried shame or guilt in the past. And they don't have to be that anymore, that I can now use them for good in the communities and in life. And now they have purpose, and it's this resiliency that shines through with that. But brave, I like that word. So yes, I think so. Thank you.
And I think you all just you just exude humbleness and humility and vulnerability, and I think that's what's helping our community move forward. So let's wrap up here. So first of all, I want to thank Tessa, Chris, and Jennifer for coming here and sharing your story. Thank you all very much. And I want to personally thank the Community Health Endowment. Without them creating this platform and this forum for us to express and share some of this information, we couldn't do it without you. So thank you, Lori, and everyone at the Community Health Endowment for the good conversations, and hopefully we increase some knowledge and awareness in regards to peer support and the impact that has on our community and our behavioral health recovery oriented system. So thank you very much.